Hey everyone, welcome back to the Checkup. We have Dr. Edwards back with us as a guest for today's podcast, and I am very, very excited this one. I'm looking forward to learning about this because it is everywhere, but today we're talking about supplements.
Yes. It is really hard to navigate the social media and
everywhere.
Everything. If you're going to get an ad for a supplement,
Yes.
it's going to happen, and they're going to be very convincing. And
They sure are.
They are. I've been tempted a few times, and I'm like, wait a minute, I'm a doctor.
I know better.
And I'm like, but. But over 50% of adults in the United States take a supplement. And then 25% of those people are not of those people. 25% of the population also is on medication with it. So it's a big industry. They make a lot of money.
A lot of coin on that.
Yes.
So, and like I said, I'm a woman of a quote unquote certain age anymore. So it is, I literally can't open Instagram without being inundated. So should I just ignore everything, or tell me everything you know? What's good? What's bad? What's the worst? Are they all bad?
They're not all bad. But usually the ones that require to be on TikTok and Instagram in order to get people to buy it are usually the ones that don't have any evidence for, or the evidence that they have is just theoretical.
A little shaky.
Yes,
A little, this is my girl on Instagram and or TikTok.
Because the FDA is doesn't approve or deny supplements. So there's nothing regulating what can be on the market. And they only are able to take them off the market if there's adverse events. So there's a lot of things on the market that are gonna, seem like they're doing something. But usually, if you get to a video and it says, "Hey, this worked for me," it could work for you. And I'm like, "Wow, that study's really large. It's one person."
Yeah, a lot of evidence there.
But you can always ask your doctor about it. But there's a lot of trends. I actually had to look them up because I'm not up to date on like what's trending in the supplement world.
Well, and it changes. It's always something different. It's always creatine is the one I saw this morning. I saw an ad for creatine this morning, and you should take this. And I'm like, I thought bodybuilders use that. I'm not looking for that.
Creatine actually does have good evidence.
Of course, the one I pick out.
No, creatine does have good evidence as long as you're not dry scooping.
Oh, okay.
Because then you can have a heart attack.
Oh, my. Well, yeah, that would be the opposite of what we're doing. So tell me, for those of us who are listening, maybe don't know what dry scooping is. Tell us what that is. So normally creatine comes in a powder form that you mix with water or another beverage, and then you take before you exercise. And it kind of helps with recovery and the pain that you get, in your muscles. But dry scooping is just taking the powder plain and then eating it instead of like putting it in a beverage. And that's actually pretty bad for you. I feel like that trigger my gag reflex. But why? So why would that be worse though than mixing it with water? Why is the dry scooping so bad? I just think it'd be gross, but why is it bad for your health?
Because it absorbs differently.
Oh,
Yeah.
Really?
Yeah.
Huh. But you said, so creatine you think does have some good evidence, though?
That does have some good evidence, yes. Some ones that have good evidence are, something like creatine or, glucosamine or costochondrin for arthritis.
I've heard of I think I'm saying it wrong, but I've heard of the glucosamine for joints, right?
Yes, that works pretty well. And then there's certain... like they have eye vitamins that are good for the eyes, and usually ophthalmology really likes that. And so, the ARADS vitamins for your eyes are pretty good, but, you shouldn't take them without being directed by your eye provider because they do have high doses of fat-soluble vitamins, and those are vitamins that you take and then they're stored in your fat. They don't leave your body. So if you take too much of them, it's just going to accumulate and keep accumulating and accumulating until you get a toxicity. Now, water soluble vitamins, those are like your B vitamins and the ones that you'll pee out if you have extra. So sometimes maybe you'll take like a hair, skin, and nails vitamin or like a multivitamin, and then you notice your urine's kind of a fun color. That's what those are. Surprise! But the fat soluble vitamins are vitamin D, vitamin A, vitamin E. Those are some examples.
We probably should have started this podcast in general with a caveat that you shouldn't take anything without talking to your doctor first. So remind everybody of that. But
yes.
And we'll remind you guys at the end too. But so tell me, so we talked about those things that are maybe not so bad. Tell me the things that we should avoid at all costs, or what are some of the trends that you're like, holy cow, I can't believe people are doing this.
We just did the podcast on the liver, and but there's a lot of supplements that talk about like detoxing your liver.
Yes, I've heard that.
Which is kind of funny to us because, in the medical community, because that's what your liver does. It's a detoxifier. So you're detoxifying your detoxifier. They don't work.
So it's like cleaning your clean clothes or something.
Yes, or cleaning
your
out
washer.
Cleaning out the gut. The only thing that's going to do really good for your gut is taking a fiber.
Okay.
Maybe also a probiotic, but there's a caveat to choosing one.
Oh, okay.
Some of the other ones that I would be careful of are ones that like balance your hormones.
I've heard that one too a lot.
Big trend right now. Yeah. So, a lot of times people hear these things on social media and feel, well, I don't feel good. Like I'm tired all the time. I have no energy. I can't sleep at night. And they, are desperate for something to help with that. Right. But most of the time there's something else underlying that is, contributing to it. And what was going to work better will be, like we talked about last time, like diet and exercise. It's not fun, and
it's not as easy either.
It's not as easy. No, it's not. But there's really no way around it. We have medications that treat various conditions and help with different symptoms, but they're never going to be as good as you just taking care of yourself. And loving yourself and giving it all the things that it needs.
That's very wise. I love that. That's very wise. Just nothing's as good as loving yourself and taking care of yourself. I think that's a good thought. So, like I said, I'm approaching menopause and perimenopause, so I hear that a lot. The balancing the hormones, but that's just BS. Is that just nonsense? Hormones don't balance. What are they?
Unless you have some sort of signs of a hormone imbalance, then you probably don't have one. Like let's say your women tracking their periods.
Okay.
If your periods are regular, chances are your female hormones are normal. And if they're irregular, then you probably should talk to your doctor about it.
Probably something about TikTok is not going to help with that anyway. Right?
No, and it may make it worse because the problem with a lot of supplements is that because they don't have to prove that, what is in the pills or the supplement is the same as what they claim, because again, nobody's regulating them. Some of them don't have anything in them. Some of them are placebo pills.
Just like sugar pills.
People have sold placebo pills and then, marketed it for something else. And so you really need to choose a supplement that has third-party testing.
So how do I find that? How can I tell if a supplement has third-party testing?
Well, some online stores and search engines, they have, that in the filter where you can click it, and then they'll only show you ones that are third-party tested.
Oh, okay.
And some of the, I have a list of the different entities that do it, but probably the best one is going to be USP certified.
Okay.
There is also NSF certification. They specifically have like a sports certification.
I feel like I've heard of that. Yeah.
That where if you were tested by a sports organization, you wouldn't have anything that's illegal to do that sport.
Okay,
in
I see
your
what you're
urine.
saying.
Yes, and so if you get a vitamin or a supplement from third party testing, they have verified that what they claim is in the supplement is what's on the label, and there's no toxic substances. So another problem with it is not just, that there doesn't necessarily have to be what they claim in the supplement, but also sometimes there's harmful things in there. Like there's they tested some generic pediatric medications, like name store brand ones, and some of them had toxic levels of nightshade for a child. And then you have ones that are testosterone boosting. Some of those, they're putting things like Viagra or steroids in it. And that's why you feel so good.
Well, yeah.
But, if you take it long term, it's going to have bad effects like becoming infertile.
Yeah.
So
that's
so
crazy.
you really should be careful about what you're choosing, and then make sure you know what's in the supplement. So it's not just, I want to take, this supplement. You can go to the store and buy it or buy it online. But again, it's choosing also a company that has been third party tested.
So even if if it's third party tested, that you can feel safe or relatively safe that that's what they say is in it is in it. But do I even if it is whatever, do I even still need that? Does that make sense what I'm asking?
Yes. Most of the time, no.
Okay. Done. Into podcast.
Because most of the time, they're relying on like the placebo effect or other other mechanisms like having something else in it, but that will give you the feeling that they claim to or do what they claim it will do. But they don't always most of the time it's just the placebo effect, because they don't have any studies and they're not controlling for it, and there may be like a couple small studies, but they're not it's not a placebo controlled double blind study that they do have some on some of the substances, but like not substances, supplements, but it's few and far between.
Sure.
Because they don't need FDA
They can just
approval. They can just put it on the market, and it's becoming more rapid. Like there's 4 times, like in the last 15 years or so, there's 4 times as many supplements on the market as there used to be.
I think because everybody wants to improve their health, but it seems so much easier to take a pill than to actually make a salad.
Yes. I have a list of some of the, supplements that can cause, adverse problems if you're taking it long term. Like beta carotene, it doesn't matter if it has vitamin A or in it or not. It'll increase your risk of lung cancer and all-cause mortality. So you're more likely to die if you are taking it, and you're more likely to develop lung cancer if you're taking it consistently. You have vitamin D is okay. Everyone should take a vitamin D 1,000 IU, which is international units, a day, because we live in a northern climate, and especially during the winter months, we're not getting that vitamin D, and we're not getting it through the diet because it's not in processed foods. It's going to be in your vegetables and stuff. So like your broccoli. Yes. But vitamin E, it was associated with increased cancer, like just any cancer.
Just in general, cancer.
Yeah, and it increases your risk of developing Alzheimer's. That's so. Like I can't remember the thing where you can't remember.
Of all the things to not remember.
But vitamin C, so there's a lot of people that, believe vitamin C is going to treat my cold. We have evidence on vitamin C, but it's that if you take a certain amount, it will help it won't stop you from getting the cold, but your cold may be shorter. Like a day.
Well, that's better than nothing.
But with the vitamin C, you also get, risk of kidney stones or other things that come with, vitamin C. So that's, but if you want to be safe, take a multivitamin. It's way cheaper.
That's what I was going to ask.
Yes.
Yes.
Just take a multivitamin. It's going to, if you're worried about, your nutrition, or if your BMI is over 30, multivitamin. You need a multivitamin.
Okay.
Because that's going to, usually if you are a BMI over 30, then you're chronically nutrient deficient.
Really? Because you would think the opposite, I guess.
Well, it's usually not high quality food.
That's true.
Again, because of the American diet. But that doesn't mean if you have a BMI less than 30 that you're not going to be also nutrient deficient. But a multivitamin is 100% fine. But some of the other ones, let's see. Anxiety and depression. There's some supplements for that too, like especially anxiety. People take ashwagandha or
yes, I've heard of that.
Magnesium, and it depends on the type of magnesium, is helpful to mood and gut health and stuff.
The glycinate, is that the quote unquote good one?
Yeah. If you take magnesium citrate, expect to be on the toilet.
Oh, well, that's
a lot.
Not exactly how you're living your best life doing that.
Yeah.
So to out myself a little bit here, I take a fish oil supplement. Is that good, bad, waste of money?
That is good, especially if you don't eat fish. It does, lower your risk of, cholesterol disorders, and it's going to be, good for you.
Right.
Taking a large amount of it is not.
No.
Because then you're getting other,
right. It's like
problems.
anything else. You kind of just have to moderate, balance.
Yes. Another thing that's good for your cholesterol is the fiber.
Right.
Now, this would be like a Metamucil fiber specifically, like either name brand or not in the powder form or the pill form. It's going to decrease your risk of colon cancer. It's going to lower your cholesterol and decrease your risk of heart disease.
So just like the container like my grandparents used to use and just do a Metamucil with some of your water?
Yeah, you need 10 grams a day to achieve this benefit. But it is good for you, and you'll be constipated.
Oh,
so it's great.
Win-win. Can you get too much fiber? I mean, probably not. Are most people not in danger of that?
You probably have diarrhea. If you
I guess
too
you
much
would know. Yeah, it's a good sign.
Now, but if you take too much fiber and you have a risk of like a small bowel obstruction, you can get a small bowel obstruction.
Yeah.
So
everything comes with a risk. It's just kind of balancing it. The other supplement that I know a lot of people use is collagen. They use it for their hair or their nails or whatever. Tell me about that.
There are some studies on it, but they're not robust studies. Like they're not like we were talking about, like those double-blind placebo-controlled studies that, say for sure that it's doing something. So there is some evidence, but it's very low quality evidence and probably not.
So not harmful, but more waste of money category, probably.
Yeah. And then there are supplements on the market for like anti-aging. Those also do not have good evidence. And so the problem is that these companies, they take a theoretical application, and they may have animal studies or just lab studies, but they don't actually have evidence in humans. So, and that's really important, is because you're spending money on this. This is like money in your pocket, and if it's not going to improve your life or actually significantly have your life extended or the quality of your life, it's not improving that, because those are clinical outcomes, then it's not worth it.
To kind of go through, is there anything that we should avoid at all cost? We talked about the things that aren't certified, for lack of a better word, but anything else that we should just avoid at all costs?
We'll put
we're going to make a supplement guide and put it in the show notes.
Yes, absolutely. And that may help guide people a little bit.
Sure.
I also have, a table of which of the trending supplements have good evidence versus low evidence and maybe some adverse reactions. And then we'll also have maybe the website where you can look up a banned substance and make sure that it's
I think that's great.
banned.
I think it's just daunting. Even if you just go to Walmart and look at all the
bunch of them.
vitamin bottles, it's just like, it's a lot.
Yeah, this is a hard topic because there's so many.
Yes. I feel like we could talk for hours.
Yeah, it's a lot to go over each one.
So bottom line, talk to your doctor before taking anything. What else?
Third-party testing.
Okay.
And, be careful what you spend your money on, because that money could have gone to,
Fruits and vegetables.
exactly.
There we go. All right. Check out the link in the show notes, and thanks for coming again. We'll have you back. This has been great. I'm sure we could talk for
Yes.
hours. All right. Thanks.
Okay, thank you.